Hello, everyone, and welcome to an episode of Humanitarian Horizons, Christina Diarcangelo Unveiled. And today I have a new guest on with me by the name of the gentleman, Mark. He has joined us to talk to us about his background in a very important topic that we're going to discuss, which I'm not going to allude to yet, because I would love for Mark to introduce himself, let you guys know what he's about, so that we can get on to this very important topic that we want to discuss today. Welcome, Mark.
Christina, thank you so much for having me on board. I deeply appreciate it, and I deeply am passionate about the topic that we're going to talk about when it comes to healthcare. You know, my background is really threefold. I'm a guy that was in the military and in the naval world and intelligence, and was exposed to a lot of things in that space. From that, ended up into seminary and was a pastor, doing a lot of work with small towns, a lot of work in communities for people who needed help and care, created a lot of ministries where I saw that there were needs not being met. All of that kind of rolled up into my tenure in healthcare, which I've been in now for well over 30 years. And I think when I rolled all those together and I started looking at healthcare, I had the opportunity in healthcare to experience every level of care, from hospital work, long-term hospital work, post-acute work, which includes just about everything that you could possibly receive after a discharge from the hospital, which did include hospice. And I was very, very passionate about hospice for a lot of reasons. I've helped a lot of people through that journey as a pastor in my various churches and parishioners, been through it personally on my end, my wife's end. But the one thing that really kind of caught my eye as I constantly look for new places to serve was, individuals that are incarcerated. And I think that as I dug deeper into that, got to know some of my key relationships, knew people inside of the system, I started having meetings with their care coordinators, social workers, people of that nature, and started asking what was being done to serve the needs of those incarcerated Americans that needed care at the end of their life, because there are so many that end up in jails and prisons primarily who spent the rest of their life there. And I was surprised to find out that there wasn't a lot being done. I don't really know the reason for that. I don't know whether it's just overlooked or people were scared, to step into that space. But, as a former pastor, the first thing I thought of was these are people, Americans, yes, made bad decisions, but they still need to be cared for. They're still human beings.
They're patients. Yeah. I mean,
there's
know
still patients.
I know personally, I don't think I've even disclosed this to you, in our conversations we've had as colleagues and some of the things that we're talking about from a work-related standpoint. But my brother was incarcerated, and he had committed ag assault. And this was like dating back to 2011. No, I'm very wrong. Sorry, 2010. Because I came back from California, came home in August of 2010, and then October of 2010, my brother had committed a crime. And he had a lot of mental health issues, which was one of the reasons why he committed the crime. I'm not trying to make excuses, but that's really why he did what he did. But he had congestive heart failure, and he was very young when he got congestive heart failure. So when he went into prison, one of my major concerns was the fact that he had to take certain medicines that were prescribed by his physician for him to stay alive. At that point, he hadn't had a defibrillator put into him. That happened later thankfully when he got out of prison, and luckily never went back. But I experienced some of this with my brother, and how the care was for him. Like, he was not given the same medicines that he was prescribed by his physician because it wasn't available to them in prison.
That's correct.
So that's another issue, right? I mean, the fact that these people, yes, they're in there because they have committed a crime, or they're believed to have committed a crime, because there's some people that are there that didn't do it and they're stuck there. But they need to get their medicines. You can't take them off their meds because you can't get access to them. That doesn't even make sense. And then to the point which we're talking about now, which is hospice, end of life. These people are terminal. They're patients at the end of the day. They're humans, to your point. We need to do better with helping these people through this transition to the other side. Whatever the other side looks like to them, we need to to do that. And I think it's
Right.
amazing that you did that, Mark, and that you were in there helping these people who, first off, don't feel like they're worthy most of the times, right? I'm sure you experienced that with these people. And it's so upsetting because they are worthy. They should be provided this type of care because they're patients at the end of the day.
Yeah.
It doesn't matter if they're incarcerated.
When the day is done, they're human beings.
Right.
And it's the humane thing to do. We can not like why they're there. That's a whole different topic, but they're still humans. And I think in my continue to work with this individual and ask him, how do we go about creating this? Because it's not really something at the time that I was doing it that the government had really put a lot of or invested a lot into. Now, there's been changes that have been made, and, the care that they get in the clinic certainly isn't substandard, but, a lot of these drugs that you end up taking to control pain and a variety of things, they're controlled substances. And of course, that violates a lot of rules within a federal government institution. And so when you start thinking about just the process of hospice and trying to meet them where they're at, to try to allow them the dignity and the respect to continue to have some normality of life, whatever that is, through that journey, whether that's 6 months or longer. I mean, that's the hospice diagnosis, that if the disease they have continues on the current course that it's on, we would not be surprised if they did not surpass a 6-month window. So for us, when we go into that space, that's a pretty critical, really sacred space, I've said for a long time. And we need to meet them with true empathy and compassion. Now, the hardest part of that was getting that understood within the system. And fortunately, I ended up having a great guy that understood it inside, which, isn't always the case. And he had a clinic that we could bring our care in and at certain times with protection provide care in that space. And it was certainly something unlike anything that I ever done. Even more so, the credit goes to the nurses that were being escorted in and out of those situations, because that's a higher calling of their task. It took special people who had that kind of empathy. But the good news is we were able to, with a collaborative spirit of really trying to do best for human beings, we were able to get in there and provide that that life care that they needed desperately in those moments. And I'm real proud of that. I think, there's a lot of people sitting in our systems that we'll never see outside again. And so their life sentence is behind those walls. Their life continues like all of us outside the walls. They still have health issues. They still will come to their end of their life, either by natural causes or others. They deserve that right to be cared for. And it was an experience unlike anything I've done in my career. I felt, and all of us that were part of it felt unbelievably proud of that work. And we were successful in giving peaceful transitions. There's also a spiritual side to this thing, that, you want to connect with. And so we would try to make sure we were utilizing the spiritual counseling that was available through the systems. And then in some cases, even outside counseling. But, most of it was handled pretty well inside at that point. We were just filling a very needed gap. There's really not any words can be said, despite life's decisions, a quiet and dignified exodus from this world to the next, I think, is probably the most humane thing we can do. And that's how I felt about these prisoners.
I completely agree with you 100%. As you know, we've been talking about this topic on multiple levels, specifically in our offline discussions. This is something that, I was lucky that when my brother passed away, he wasn't in prison. He was out of prison at that point. As I alluded to before, once he came out, he violated one time. He went in for a short stint and then came out and then stayed out, thank God. So when with his heart, he eventually had a defibrillator placed in there, and he ended up passing because he got COVID, which was, he was one of the percentiles with the issues already pre-existing.
Yeah.
And COVID just took over his body because his heart was only working at 18% capacity when he walked into the hospital with COVID. So, but he didn't have insurance either. So that's a whole another can of worms.
Animal.
I'm not going to bring that up today. We could talk about that another time, but some of the way that his treatment kind of fell through, I was like, is it because he's, Medicaid? Is that why? Because I'm a pharma person, so I know it's out there, and I worked on COVID since COVID started. So I didn't work on the vaccines or Paxlovid. but I was working on other things. So I understood COVID really well. So I was kind of jaded a little bit about that. And I wrote about it in a book that I'm going to be releasing soon about another topic that was near and dear, relational to my mom. So I was just so glad, though, that my brother passed away outside of prison, and that thank God he didn't pass away while he was in prison, because I can't imagine what it would have been like for, I mean, the families, right? We don't even talk about that, right?
I was just going to mention that. Yeah, I was just going to mention that. I think that the part that we don't stop and think about, we're so, as a society, we are definitely wanting individuals who have done horrible crimes to serve time. And, that's another topic, on for another day. I think for me as a military man, as a pastor, I think for me, there's an honorable thing we have responsibilities to do to each other. And granted, there's a lot of things happening in this world that's anything but honorable, but that's not an excuse for us who have a moral gauge and who understand the value of the humanity we've been given. And the part of it that, another element of this whole thing that I wasn't prepared for, that I ended up being brought into, was the families. We sometimes forget that whatever the reason is, whether rightfully or wrongfully incarcerated, that's another discussion for someone else to tackle. They're still family. They're still part of they're someone's son, they're someone's grandson, they're a granddaughter, or,
a husband, wife.
And there's still family out there that are concerned about them, visiting them, sitting there waiting to see them whenever they can, and writing to them. When you start to realize that when you meet these individuals to care for them, you're not just caring for them, you're also caring for their families. You're allowing their families to see humanity being shared with their loved one, which, let's be honest, is probably not as much of that seen in the system. It's governed by rules, and the rules are the way this thing works. But how nice, in a sad situation, but how nice that here's somebody that's going to come in and love on, their loved one. And they know, they're a part of the process. Death is not a singular event. It's an event that touches many people's lives. And for them to see in those moments, despite the circumstances and locations and all that, but in those moments, there are still human beings out here who love on people for who they are, and are not necessarily using the determination of whether they love them based upon what they did. And, I think that's the purest form of love, and so we love people where they are. We give them what they need. And that's the true essence of what hospice is about, way back from the days when Dr. Tobin wrote his book about peaceful dying. This is what hospice is. And I think there's a huge, and continues to be a huge, opportunity inside of this space where we can make a huge difference for those individuals who are in those moments of life. I think one of the big hurdles we'll have to continue to fight with and overcome is navigating with the institutional governments. They're not as accustomed to this approach because they're not designed that way. They're designed, you've done a crime, you'll serve the time, and everything is structured, rightfully so. I understand that. From my military days, there's value in that structure, and I get it. But I think we've got to be careful that we don't put structure over genuine care when care is needed.
Right. And empathy, right?
Yeah. There has to be. You got to have some empathy. For me, it was a life-changing event. Would love to be a part of seeing that grow into something bigger. And I know many are trying to do it. So, I certainly was not the only person that's ever reached into those systems. There are other hospice companies and others from religious background, churches and things of that nature, trying to find ways to expand. There's no doubt there's a great need here.
Well, what else I was thinking about was when you were talking about, when we brought up the family aspect of it, that's someone's family member, right? Well, we've both had losses. We both have people who've passed away, or multiple people that have passed away in our lives.
Yeah.
And there's grief, right? Because you're left behind. They have gone on to the other side, whatever that you believe, whatever, right? They're not here anymore in this physical form of earth. I would think that these family members having the access to the hospice program like this, and knowing that their loved ones are being treated fairly, I would think that their grief, although it's going to be terrible, their grief was a little bit better, at least for the fact that they know they're not worrying that the person, their loved one, died alone in a cell.
Correct. And
they're found dead. Because how many articles do you read, Mark? I read every day, a lot of news, I pay a lot of attention to the incarcerated individuals and the prison systems and things of that nature because of all the work I do. How many times do you read articles where someone is found dead in their cell?
Oh, yeah.
And then their family gets that unfortunate phone call saying that that person has died. So I would think that having this would help them at least grieve a little bit easier.
Yeah.
Because now they know their person didn't die alone.
Yeah, I think it's a great point. And that is, and again, that's another beautiful aspect of hospice, is that our goal is to surround them with loved ones who, are in the medical industry who care. And depending on their diagnosis and depending on where they are in their stage, it has a lot to do with how many hours are attributed to that person. So, as they get closer and closer to their peaceful exit, they'll see more and more of people being around them and checking on them, making sure they're comfortable and communicating that information where appropriate. There's another big piece of hospice that I think is so many times forgotten about, and you alluded to it with the family. One of the hospice benefits is that there's counseling for the family for a year after that individual passes on. Mm-hmm. And it's not utilized like it should be. And I don't really know why, because we kind of want to just tuck ourselves away. Mm-hmm. I just recently lost my son. Mm-hmm. And I went through the same mental struggle. Mm-hmm. I wanted to be left alone. Mm-hmm. And yet when the day is done, that's not good. Mm-hmm. And the benefit of hospice, my son, of course, didn't need hospice, but a loss is a loss. Right. And the reactions to it are the same. But there's a benefit that's extended to this family who's just lost a loved one.
I would agree with you 100% because when my father passed away in 2015, which that's the whole reason why I started the nonprofit Affinity Patient Advocacy.
Right.
He was in hospice and he died very fast. He died less than 2 months from diagnosis. And he wanted to be in hospice. He wanted to die at home, which was a home that he worked really hard to pay off, and I messed up when he died because first off, I was so busy caring for him as his advocate and making sure I was supporting him and making sure everything was done the way he wanted it to be done. And that, we respected him as a patient and as a human because he was a tough guy, and he wanted to still do things for himself.
Sure.
I should have, because when he died, it was like, okay, my job is done now, right? He's gone. I wasn't really, even though I knew it was coming, I wasn't prepared for that. And I never got therapy for him, which I should have done through hospice, to your point. Yeah. I didn't start doing therapy until 2019 when I had some other things happen in my personal life. And I had to open up about my father's death. Yeah. Because I never did. And it changed me so much when he died, to the point where I was not the same person anymore. Yeah. And, since he passed away, my uncle passed away. I helped him, I advocated for him. I was with him during hospice. So then I was reliving my father dying again because they were very similar. It was 3 years thereafter. And then my brother passed away in 22 from COVID at 43. And then my mom just died last January. We're coming up on her 1 year anniversary. So all these deaths have been so different in the grief process for me. And my brother and my mother weren't in hospice either. But because I know better now from what I do with my dad, I know that I can reach out to my therapist if need be. But now I have a toolbox, right? So I know what to do. But before I didn't, and I was useless. And like you said, you kind of go into a shell and you're just like, I don't want to talk about it. I'm just doing what I need to do to get by. I threw myself into work because I'm good at that. I'm sure you did the same thing. I know I talked to you after your son had passed. And it was a business meeting. So, I think that although we're talking about hospice and incarcerated individuals, I think it was important for us to talk a little bit about the grief side of things as it relates to these family members, so that they realize that there's support out there for them, so that they don't do something then because they're so upset, they're not thinking straight, and then they end up in prison.
Well, and I think that, we just sometimes don't see the really global picture of the world of death and dying, which, I've spent a lot of years in, both as a pastor and then as a professional inside of hospice. And we want to do everything that we can do. I think it's our human responsibility to do everything that we can do to allow that individual, forget about any of the circumstances, just deal with the individual and what they deserve when it comes to the death process. And, I've seen a lot of different scenarios play out in my years in hospice. And the best death, as is referred to in Dr. Tobin's book, is a death where there's peace and where there's family around and they're at peace. And, I remember standing by the bedsides of many, many, many people as a pastor, as that last breath on this side of eternity and ushered into the next was taken. And I don't think you can't find, I can't find the words that describe that moment, but I can find the words to describe the looks on the family's faces and of the person that we were giving hospice to. I can describe that piece.
Mm-hmm.
And you don't forget that. That is something that you carry the rest of your life. Those families will know to the very end that their loved one was loved on by people, as I call them, the angels of hospice, who do it for the right reason. All the years I was in hospice, I never found anybody doing it because it was a job.
Mm-hmm.
Matter of fact, when I interviewed people, I would ask them, why do you want to do this?
Mm-hmm.
And the ones that did it and stayed in it for years, and I still have a lot of friends still in hospice, nurses and various people, they see it as a mission of God to do the right thing. And Lord knows we need more of that today.
Yes, we
do the right thing. And so I will always tip my hat to individuals that are in this space. I've been through it. I've helped my family, my wife's family, and many personal friends, parents, as a pastor, move on in their services and been there in their last breaths. And we're all human beings, and we are all going to pass, and we're all going to face this at some point. We don't need to face it alone. We shouldn't face it alone. And I don't care what's happened in life that may have changed the circumstances. The right thing as human beings is to be there and love on those individuals through the end. And that's what hospice does.
Thank you, Mark, for sharing all this today, because I know it's not necessarily easy either, given the fact that you're bringing up all these people that you've helped over the years. It's here now, right now.
I think of many of them as we talk.
And then you just recently had a loss yourself. Yeah. So now we're talking about loss, which is never easy really to discuss, but I commend you for being vulnerable and to come on and talk to me about this stuff, because it's really important that we share this information with people so that people understand that there should not be stigma attached to incarcerated individuals at the time of their death.
I agree with you. Thank you so much. I've enjoyed our conversations and the time to get to know each other. I've thoroughly enjoyed this conversation because it's, as you know, it's one that I'm very passionate about.
I share in the passion with you, as you know. Yes. So with that said, we're going to end for today. Thank you again, Mark, for joining us. And thank you to all of our viewers and listeners for joining us on this humanitarian effort to share information as it relates to incarcerated individuals in hospice. Thank you.